with all of us having to stay inside, vanity sometimes can take over and our beauty regimens are getting upended. So there's all these devices out on the market that we can do our normal beauty routines at home and perhaps use these products, but are they safe? Dr. Elliot Hirsch, a board certified plastic surgeon, is joining me now to talk a little bit about that. Hello, Dr. Hirsch.
Hi, how are you?
I am great. Okay, so I have seen ads for all kinds of things, microneedling machines and laser hair removal and lip plumper devices. Are they safe?
Well, you got to look at each one by itself. You know, let's start with microneedling.
Okay.
Microneedling, it's a great treatment in the hands of a professional who knows what they're doing. Microneedling is a process where a tiny little needle punches a bunch of little holes kind of into the skin. And what that does is it stimulates more collagen synthesis, smooths out fine lines and wrinkles, plumps the skin. It's a really, really good treatment. But if it's not done by a professional where they're using sterile equipment and proper protection, if you're doing this at home by yourself, it's easy to cause scarring. It's easy to cause infections. The depth of the machine, the depth that it punctures with the needle is not regulated. So you don't really know what you're doing. And it's going to be hard to fix the kind of scarring and damage you can do to yourself if you're not trained in these machines.
Yikes. Okay, let's talk about, I have definitely gotten ads in my social media feeds for lip plumper types of devices. I mean, I've seen all kinds of things on the internet. Is that going to work?
Well, yeah, what you have to think about with those is what's the purpose? What are you trying to accomplish? You know, if the way they work is they basically put suction in the area around your mouth, and what that does is it causes a temporary increase in blood flow to the area of your suctioning. And so the result of that is that it looks swollen. Makes sense, right?
Sure.
Now, from a safety standpoint, as long as you're only using it for a short amount of time, like if you're about to go out, you're looking to look a little more plump, you want to do it right before you put your lipstick on, it's probably fine. But if you do it for too long or with too much pressure, it can cause blistering, scarring, very common to get kind of like a juice mustache around your mouth, which usually isn't the look that people want when they go out for the night.
Right. Okay. And then let's talk about the laser hair removal devices that are, you know, at home. Obviously, when you're working with lasers, I would imagine that is dicey if you're not trained on that either.
Yeah, absolutely. It's a similar type of deal with the microneedling where, first of all, the lasers, they're not nearly as powerful as the laser you can get if you go to a doctor's office. You know, if you go to a place that is a professional handling the laser, that's a much better laser. So, for example, the laser we have in our office, it works very well. It does laser hair removal. It also has a cooling function, so it's not that painful. The ones at home, they don't have all the extra things. So if you're doing it, number one, it can hurt. Number two, it's easy to cause more scarring, more pain, and basically just not the right way to do things. All these at-home products and devices, they're not FDA approved. So you have no idea what you're actually doing when you're using them.
Now, is there anything that we can do right now that would be safe? Because like I said at the beginning, we're all having our lives upended. You know, everybody's roots are all grown out. Botox is going away. Like, we're all a mess right now. You know, all my friends, we're all like talking about what we can do at home safely. Is there anything you can recommend?
Yeah, absolutely. In fact, we have a podcast called Below the Surface, and one of our upcoming episodes soon is going to be an in-depth discussion about home beauty regimens and things you can do at home to kind of keep your skin looking as good as it possibly can. But a couple of things that I'm recommending. Number one, just by virtue of the fact that we are inside, it's a good time for our skin. We're avoiding the ultraviolet radiation, we're avoiding the sun damage, which is common now in the spring as the weather warms up and a lot of people start going to the beach. So that's a good thing. Avoiding smoking, you know, it's a very stressful time. A lot of people smoke. If you can control that, it's not as good time to focus on yourself since you're in the quarantine. If you can stop smoking, it's great for your skin. Other things that are good, number one, having a good skincare regimen. So you're not going to be able to do a strong laser or a microneedling treatment, but washing your face. Washing your face with the right kind of oils twice a day can help moisturize, exfoliate the blackheads, clear out your skin. Also having a good skincare regimen. You have your night cream, your day cream, staying moisturized, hydrated. It'll go a long way.
All right. Well, and on a personal note, how are you doing? How's your family? I mean, are you having to, what's happening with plastic surgeons right now? Are you having to go and help?
Well, so right now, the way it works is that most plastic surgeons like myself, we do elective surgery and non-elective surgery. So, for example, the elective surgery would be the cosmetic procedures where, for example, breast augmentation, tummy tuck, facelift, that kind of thing. The non-elective surgeries are things like breast cancer surgery or certain urgent skin cancer surgeries or, different reconstructive procedures like that. So those procedures we're still doing because breast cancer doesn't wait for the coronavirus. It still needs to get done. The other things we're all kind of holding off on for now. And so we do, we're doing a lot of FaceTime, just like you and I are on Zoom, a lot of FaceTime consultations. Other things like that, the hospitals in our area have not seen the surge yet, and their ERs they're very well equipped, and they send out email communications weekly. We're all keeping an eye on it. And then, if the need arises for us to do other things, we're here.
Well, Dr. Hirsch, thank you so much for your time and just trying to get us through this weird time right now. We appreciate it. Thank you so much.
You're welcome. Take care. Stay safe.